and thank you for joining us here this morning. As we see the Omicron variant continuing to spread across Saskatchewan, across the nation, and around the world, I just say that we've been tracking the hospitalization and ICU numbers quite closely, not just in our province, but in every other province and some other areas around the world as well. And all of which, in the case of provinces in Canada, all of which have implemented some level of restrictions or lockdowns over the course of the past number of days and past few weeks. So we've been watching also very closely to see if those restrictions are working to slow the rate of transmission of Omicron in our nation, as well as whether or not they're slowing the rate of hospitalization in our nation as well. We are now seeing an increase in hospitalizations here in Saskatchewan, and we're watching that very closely, and that is concerning when we see those trend lines moving up. But we've actually seen the hospitalizations and the ICU admissions, more importantly, increase at a much larger rate in virtually every other province across Canada. On December the 21st, just prior to Christmas in Saskatchewan, we had 98 people in hospital with COVID. We had 31 in our intensive care units. Yesterday, we had 121 in hospital and 11 in our intensive care units. My first inferences today as they work through today's numbers is our numbers are fairly steady. Our test positivity, again, today is quite steady. Our hospitalizations look to be holding steady, and our ICUs look that they might even be down slightly today. But back to that 121 in hospital, 11 in ICU from yesterday, that's an increase of about 23% in hospitalizations in Saskatchewan, and it's a decrease in our ICU admissions of about 68%. When you look across Canada and compare what's happening in Saskatchewan to other provinces, during that same time period, from December 21st till yesterday, hospitalizations are up nearly 5 times, and ICU admissions have more than doubled. And the same thing is happening in other areas of the world, in countries where there are less restrictions even, and in countries where they have even more restrictions or severe lockdowns in some cases. Omicron continues to spread around the world and across Canada. This is not meant or directed as a criticism of any government. They're all trying to make the best decisions that they can on behalf of their citizens, and some of them, quite frankly, are dealing with an underlying Delta population that we just simply didn't have here in Saskatchewan as we went into our Omicron wave. But it does help us inform the decision-making that we are making here today and that we are making here in this province. While restrictions have been necessary at times over the course of the last 22 months, and I think at times they have been quite effective during previous waves that we have faced. But it's now clear, at least in this Omicron wave of the pandemic, that lockdown policies can cause harm in our communities, often with little or virtually no benefit. They cause economic harm by taking away jobs and removing family livelihoods. They cause psychological harm by taking away social contact, most particularly for our youth. And they are an infringement on the rights and freedoms that we have come to enjoy and value as Canadians. And that's why they should only be used if absolutely necessary, and only if they can clearly be shown that they are being effective and they are working. And we're not seeing that as being the case today. There are many more things that we can do as individuals in this province and around the world, and I would suggest things that we should do to protect ourselves and to protect those that are around us, those that we love. We are doing those here in Saskatchewan. Individuals across this province are doing this. In fact, there's a couple of areas that really do have an impact on our Omicron populations, and more importantly on our Omicron hospitalizations. And we are leading the country in some of these metrics that really do have an impact. First, we should all get vaccinated, and then we should go and get our booster shot. Vaccination is not preventing the spread of Omicron. We need to be very clear and honest about that, but it is preventing serious illness, and it is preventing people from landing in our hospitals. If you are vaccinated and you contract Omicron, you are far more likely to experience only mild symptoms, if any symptoms at all, and you're far less likely to end up in one of our Saskatchewan hospitals. So go out and get vaccinated, and then go out and get your booster shot when you're eligible. Saskatchewan is leading the nation in booster shots. We now have nearly 40% of all eligible residents age 18 and older have now gotten their booster shot, and we have many booked in the days ahead. We also, it's important for us to note where those boosters are located in our society. We have more than 2/3 of Saskatchewan residents that are age 60 and older, and that is the age group that is most at risk at severe outcomes from COVID. But more than 2/3 of folks age 60 and over in this province have went out and gotten their booster shot. And that, I would suggest, is keeping them out of hospital, and it most certainly is keeping them out of our critical care departments. We're also leading the country in the distribution of rapid tests, at-home rapid tests. Rapid tests are widely available in community after community throughout this province. In fact, we're now hearing stories of Saskatchewan people that are mailing some of these rapid test kits to their friends and relatives in other parts of the country, who in many cases are having trouble accessing these at-home, very convenient rapid tests. These are the things that are making a difference in this province, and these are the things that potentially have the ability to make a difference in other provinces as well. So getting your booster shot, that does work. It keeps you from getting sick. Rapid tests, they do work, and they work very quickly if you have them on your shelf at home and you use them. They keep you from getting those around you very sick. Wearing a mask works. It also protects you as well as those that are around you. So let's keep doing those things that are working. So today what we're announcing is that our current masking as well as our proof of vaccination requirements are going to be extended for an additional month until the end of February. And once again, I want to take this opportunity to thank all Saskatchewan people for their adherence to these measures that have been in place. They are making a difference. They're making a significant difference. Omicron, as we know, is extremely contagious. It's going to run its course here in this province, and it's going to run its course across Canada and around the world. It will peak, and then it will start to decline, which may already be happening in a couple of countries in other areas of the world. Until that happens in Saskatchewan, we will see some increased hospitalizations, and we will see some pressure on our healthcare system. And I think tomorrow you're going to see our Provincial Emergency Operations Centre is going to bring forward some surge plans that they have within our healthcare system. But so once again, I would just say I thank you to all of those healthcare workers in every part and in every community of our healthcare system here in the province for everything that you've done over the course of what has been a awfully long time, but also for everything that you continue to do to care for Saskatchewan residents throughout this pandemic. And for the rest of us, we have a job to do as well. Let's all continue doing our part. Let's go out and get vaccinated. Then when you're vaccinated, go out and get your booster shot when you're eligible. Go out and pick up some rapid tests and have them at home and use them. Use them when you feel it's necessary. When you go out, let's be patient and support one another. And let's show our proof of vaccination when it's required, and let's wear our mask when it's required as well. This is ultimately how we have gotten through this the last number of months, and it's how we're going to get through it through the next number of weeks. Dr. Shahab?
Thank you, Premier. So I'll just maybe go over a few points and just reinforce some of the comments the Premier made. First of all, I think we all agree we are in an entirely different phase of the pandemic now. Something that's fundamentally very different from the previous 4 waves that we've had. A variant that some had postulated could come, but the world is only experiencing since late November. So, we need to rethink our approach. Daily case numbers are really not going to be very informative going forward. We'll still have them based on PCR testing, but they're not going to be informative. Last week I said maybe they're capturing 40% of actual cases. Now it's maybe 20 to 30%. Some jurisdictions are saying that it's maybe 10%. So I think we just need to recognize that, and it doesn't mean that all of us should try to get a PCR test. What it means is if you have mild symptoms, stay home, see how if they settle, stay home till you're better. If your symptoms are progressing, pain in the throat, fever, you can call 811 to see if you have underlying risk factors and need a PCR test. Otherwise, again, staying home for those 5 days, and once you're symptom-free, you can go back to work. If you have a rapid antigen test, you can try that. But again, a rapid antigen test may be negative, and you still may have COVID, so it's still important to stay home if you're symptomatic. And, we really need to revisit the basics with the order extension into February. Those are our most important tools. Wearing your best mask, try your different masks and how they work. Some can be a higher level of mask, but you can use them for up to 40 hours. So you can have 5 masks one day of the week, and those 5 masks can last you 5 weeks, for example. So a good mask that seals well around your face, which is moving back and forth in the front, no air leakage on the side, is going to keep you safe from others and is going to keep others safe from you. I think that is fundamental. Secondly, boosting is so important. 2 doses did really well against Delta. In the Delta wave, the bulk of our hospitalizations were in unvaccinated, and as we saw in previous waves, up to 20% people required some high level of care when there was no vaccination. 5% required ICU care, but we had lower case numbers. With Delta, we had higher case numbers, but up to 5% required hospital care, mostly those unvaccinated. 1% required ICU care. With Omicron, it's maybe 5 to 10 times more transmissible, so we are going to see 5 to 10 times more cases. We have to make sure that we don't see them all at once over the next 2 to 4 weeks. We can spread it out over 6 to 8 weeks so that the pressure is lower at any given time, and minimizing unnecessary travel between communities as well, so that all communities large and small, don't get the peak at the same time. But 5 to 10 times more transmissible, less severe, but certainly not inconsequential if you're unvaccinated. If you're unvaccinated, maybe the risk is not 5% for hospitalization, the risk is 1% or lower, but it's still there. And even if the risk may not be for ICU, it is still, the risk is there, even though, if you're unvaccinated in some other countries, there are reports now of young people who are unvaccinated with Omicron requiring ICU care, especially if they have other risk factors as well. So I think it is critical that, the 14% who still haven't received the full 2 doses, this is the time to get your first shot, and then in 3 to 4 weeks, get your second shot. And then 2 doses up to 4 to 6 months do protect against hospitalization. But then, of course, like the Premier said, we were first out with boosters starting in September for long-term care, and then 80 plus in September, 65 plus in November, 50 plus early in December, then 18 plus after 3 months in mid-December. So if you are 18 and older and more than 3 months after your second dose, boosting is going to be really critical. 50 and over, 40 and over with risk factors, it'll keep you out of hospital. Even though this is less severe, it'll further reduce the risk dramatically, and that in turn will reduce pressure on the hospital system. But even for anyone 5 and older, completing the second doses, and anyone 18 and older, once you're 3 months out from your second dose, getting boosted will, in addition to mask use, reduce your risk of severe illness, and reduce the risk of others who may get exposed to you, friends, family who may be at higher risk, co-workers. So boosting and best mask will protect you as well as protect others. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll now take questions, and we'll start in the room. Connor?
And this is common. Given experts say high vaccine rates in the population are key to getting us out of the pandemic, would you consider following Quebec's proposal of a tax on people who are not vaccinated and don't have a medical exemption?
No.
And why not?
Well, we haven't looked into it. And what I heard yesterday was from Premier Legault was that, Quebec is going to look into, possibly move forward with, but going to look into whether constitutionally they can even do this. And so that's what I heard yesterday from the Premier of Quebec. I suspect they will look into constitutionally whether they can do it, and then through the parameters of the Canada Health Act, which are quite clear on what the jurisdiction that provinces have when it comes to delivering health care, and what ultimately provinces are going to do to provide that health care. And then the funding is also quite clear that's provided by the through the Canada Health Transfer, ultimately to the provinces, which all of the provinces have said needs to increase as a unanimous ask before the federal government. That the federal government, I would hope, as we find our way through the second year, closing out the second year, 22 months now with this pandemic, that the federal government most certainly should, give some serious consideration to moving forward on what is a unilateral ask from all of the provinces. So Saskatchewan hasn't looked at this. We have no intent to ultimately look at a vax tax, if you will. If Quebec wants to look at whether or not they can do that, which the Premier indicated yesterday, they're free to look into that. We're not doing that here.
Follow-up, Connor?
For Dr. Shahab, speaking to the mother of a 9-month-old who was briefly in hospital with COVID this morning, is Omicron affecting younger people, and why is that? And I guess what message do you have for people if that is the case?
So excellent comment. So, over Christmas break and New Year's break, we were monitoring daily, even though they were not being reported case numbers, and they were all increasingly Omicron. And similar to other jurisdictions, initially most of the Omicron cases were, just like with previous waves, in young people who are out and about, more active socially, more likely to work frontline in many sectors. So initially the bulk of our cases were in the 20 to 39-year-olds. But if you look at the breakdown, for example, from January 10th, about half the cases are still in that 20 to 39 age group. But we have now, obviously, with school reopening, we have some cases in school-age children, but not dramatically higher. And schools just reflect transmission in the community. So, and schools are managing to continue. They started on time and are continuing. We have out of, 1,027 cases from January 10th through PCR test, and that's just a fraction. We had 34 in under 5. So very small proportion, but again, we have to understand that if households are boosted or fully vaccinated, if daycare staff are vaccinated, that protects under 5. And of course, getting vaccinated in pregnancy is so critical that, those rates, I have not been able to get the vaccination rates in pregnancy for Saskatchewan mothers, but getting vaccinated in pregnancy protects mothers who are at higher risk from COVID and protects children when they're born for up to 6 months. So that is still critical. But again, we will expect to see, especially children, under 1 and maybe under 4, that they may develop with the Omicron a kind of bronchiolitis that the children can also develop with RSV or other respiratory virus. So, what our pediatrician colleagues are saying is that, yes, it will be a concern, but hopefully not as severe as previous waves of COVID. And of course, children under 5 can't get vaccinated yet. And then the other more important thing is that, just an example, a third of the cases were in people older than 40, so 282 in 40 to 59. So more high risk. And this age group especially should all be boosted by now. And then 68 cases, 60 to 79, 12 in 80 plus. So still very few cases in 60 and older. Those folks may not be out and about that much, maybe shielding themselves more. But once we start seeing more transmission in these age groups, both the under 5, but also especially over 60, then unfortunately, even if you're fully vaccinated or boosted, and we have that in our breakthrough report published yesterday, you still may see a smaller proportion requiring hospital care. And again, that's why it's again important, get boosted, 18 and over. And if you're 60 and over, have risk factors, obviously your best mask protects others from you, but also protects you from others. And be especially careful around gatherings and other situations where you may be exposed. One other thing I'll just say that, long-term care is also now seeing more and more transmission. And again, if you are going to visit someone in long-term care, be sure you're boosted, wear your best mask properly, hand hygiene, maybe doing an antigen self-test before going. I think that is going to be really important as well.
We'll take our next question in the room. Britton?
I know we haven't seen the hospitalizations rise, but Omicron is going through the community. There's a large number of cases. It is causing classrooms to be half full, sports tournaments canceled, businesses unable to have enough staff. So why not bring in something as simple as gathering limits, not shutdown, but just some gathering limits to maybe slow the spread of this?
I don't know that those are working in any other province across Canada. We're seeing numbers continue to spread in areas that have restrictions in place that go far beyond gathering limits, and the numbers of the Omicron spread seem to continue, even in those provinces or other areas of North America. If you look across North America, by and large, the approach that we've taken in Saskatchewan, get vaccinated, get your booster shot, wear your mask, and ultimately have some rapid tests at home so that you're able to identify if you do have COVID in a much quicker manner than you would be if you were to bring everyone together, for example, a PCR test, or much quicker than you would be able to in virtually any other area of Canada right now, and in many cases across North America. Listen, as we look at public health restrictions that would be put in place that ultimately would limit people from coming together, whether that be in schools, whether that be in workplaces in our community, it doesn't seem to be slowing the spread of Omicron in other areas of Canada. That being said, when you put in place those limitations or those restrictions, there are other consequences that are being discussed in other areas of Canada today. There's consequences for us if we were to keep 188,000 kids home from school for over the course of a week or a month. There's consequences for that for our students, some of which I don't know that we fully understand today. That being said, and I think in the case of schools, but the same extends to the businesses and workplaces that operate in our communities, our opportunities to come together for gatherings in our communities. There's going to be interruptions, and we should expect that there is going to be interruptions over the course of the next number of weeks. In the case of schools, there's going to be interruptions for individual students. There's going to be interruptions for classrooms, and there's going to be interruptions at times for entire sectors or the entire school. We should all be patient as we work our way through this. We should expect and plan for those interruptions. I think Dr. Shahab had expressed last week that if you are in any way involved in offering an essential service, you should be planning for a contingency plan in the case of these interruptions. But I would just say that we should be patient as we work our way through this. We should support one another in our families, in our communities, in our school environments as we find our way through these interruptions, because the consequences of the other decision of keeping 188,000 kids at home, keeping the bulk of our workforce at home, there's consequences to that like I say are unbeknownst to us at this point in time. And so this is the path that we have chosen as we're going to, continue to move forward in this province, provide all of the tools that are available so that individuals and families can do their own personal risk assessments, and they're doing that. Sometimes they're choosing to come together, sometimes they're choosing not to. But to provide all of those tools and allow Saskatchewan people to make the decisions to ensure that they're providing a safe environment, or as safe environment as possible for them and for those around them, their family, those that they ultimately love. And I would say that it's working. In Saskatchewan thus far. When you look at our hospitalization rate, it is up, and we're watching that closely. It's up nowhere near to the numbers that we're seeing in other provinces across Canada. And in the case of our ICU rate, we're actually down 65% since just prior to Christmas. So for that, I would say thank you to the people of Saskatchewan for what they're doing each and every day, and they are altering how they're doing things. And I would also say to them, they can be proud of the effort that they're making, because it truly is making a difference in this province, and we need to keep it up, in particular for the next number of weeks.
Follow-up?
Anything to add, Dr. Shahab?
Yeah, I think I'll just go a few things. So, I hope many of us had reasonably happy, family time and time with friends and family over Christmas and New Year. But now that we're back to school, 130,000 plus students, 30,000 plus staff, they all belong to households where there may be others working in other sectors as well. So, we have children in daycare, generally managing well. We are seeing high number of cases, but and schools are doing a great job of maintaining in-person learning even when there are staffing pressures. But obviously, with reduced isolation times, that is helping somewhat with the staffing pressures. But again, what that means is that, everything else that you're doing outside of school and work, just think through. If you have a small, consistent groups of family and friends, you can meet carefully. But if you have people who are at higher risk, think through about how frequently to meet, how to meet. And also, maybe reducing some of the more discretionary contacts outside of school or work is going to be important, especially for the next 2 to 4 weeks. I think that's critical. Like the Premier said, many workplaces have really sorted out how they're going to manage people who can work from home are working from home. People who do shift work, they're making so that shifts don't mix people from one shift to another, so that if one shift has COVID, the other two shifts can manage. And there's many checklists, like WorkSafe BC has a checklist that many workplaces are using. It's a simple checklist to take off all the points that you should in terms of how to manage the workplace. One thing I'd just like to say is that, we've seen in some provinces, northern communities have really had a large outbreak. So in the past, with Delta, for example, a community of 1,000, you could get up to 100 cases as a cluster over 2 to 3 weeks. With Omicron, within a week, you can get 300 cases or 500 cases out of 1,000. It is challenging. Most cases will manage at home. Less number of cases will require hospitalization, but even if it's less proportion, even 0.3% of 500 still could be 2 or 3 people requiring hospitalization compared to 5% of 100. So I think northern communities really need to plan ahead for that, because you need to have a contingency plan. Even if you are asymptomatic, antigen positive, you can still maybe do essential work like keeping the water plant running, other essential work in the community, as long as you're not exposing others, and there's provision in the public health order under isolation for that. Similarly, many northern communities have always been very resilient, during natural disasters. They've always supported each other. So I think a lot of northern communities are planning for that. It is going to be unsettling because, you suddenly see a larger number of people impacted, but, try to prevent that in the first place, slow it down by reducing unnecessary travel between communities. But then having a contingency plan, I think, is going to be really important.
Follow-up, Britton?
I'm just wondering if there's any provincial programs for businesses or people who can't work because they do test positive or can't open because they don't have staff, because I don't think they qualify for federal programs because we don't have any lockdown restrictions in place. So I'm just wondering.
Yeah, what we've heard through the BRT from a number of different organizations is to make the tools available to us and to our staff and to families so that we can stay open and so that we can conduct our business and allow keep our employee base, which they value very much and which oftentimes have been around in that particular business for a number of decades, as opposed to qualifying for federal payouts when there is restrictions put in place and when ultimately some of those staff have to go home on a temporary or permanent basis, which ultimately means less dollars for the workers from a federal program as opposed to if they're actually working. And the vast majority in the province are continuing to work throughout this pandemic. There is that isn't to say that there are some individuals that aren't impacted by, for example, large gatherings not being able to come together in many cases, or a 5-day isolation period that they ultimately have. And I believe there's some regular provincial through collective bargaining and things that will help with the 5 days that you ultimately have to isolate through sick pay or things of that nature. But for those the individuals that are impacted, and this is something that we may raise with the federal government, is the program that they have put in place may have some holes in it that they could plug to ultimately expand that program to individuals as opposed to blanket applications to entire provinces. That being said, because of what Saskatchewan people are doing and utilizing the tools that are before them, and because of where we see our hospitalization numbers, which we're tracking and watching very closely day by day, the job numbers in this province, continue to show strength. In fact, I think in December, if we weren't leading the nation, we were among some of the strongest job numbers that were released across the nation. And so, Saskatchewan people can be proud of the efforts that they're making, because they are allowing us to at least conduct ourselves to some degree in a normal fashion here in the province, and they're allowing us to preserve the career opportunities that we have.
We'll take our next question in the room. Mickey?
Pardon my ignorance on this question. I'm not very good at math, but if Omicron is 5 to 10 times more contagious than Delta, and we're seeing other provinces hospitalizations go up by 5 times, won't the same amount of hospitalizations we've seen in previous waves here in Saskatchewan come in the coming weeks?
Yeah, that's exactly right, actually. Your math is better than mine. But, I think that's exactly the point, that more transmissible, 5 to 10 times. Severity, it varies. And I would like to emphasize that severity is still higher. It's less than Delta, but still higher in unvaccinated, higher in people who are unvaccinated and may have underlying risk factors or older. Severity is less in people who are fully vaccinated, but still there may be some hospitalization, especially in older with underlying factors. That's what our breakthrough report that was posted yesterday showed. And really, even if you're boosted and are immune suppressed or older, you can still require hospitalization, much lower proportion, but still require, and that's why you really have to shield yourself for the next 2 to 4 weeks. But then that's exactly the challenge that the SHA will presenting the surge plan, that 5 to 10 times most transmissible, maybe 40 to 20 times less severe, but still can result in the same degree of hospitalization. But again, what data from the UK and other provinces showing that more acute care, maybe shorter length of stay, less reliance on high flow oxygen. So it's a different nature of illness. It's more kind of, shorter term, kind of upper respiratory type of illness, not really, in many cases, the extreme impact on your lungs that required longer length of stay or ICU care. But having said that, I think still there will be pressure on not just acute care and ICU, and that will have to be tracked closely. And I think, and one thing that we do want to maybe try is the surge doesn't come quickly in 2 weeks. It doesn't come across all the province right now. It started Regina, Saskatchewan. It's impacting some other provinces. Some of the wastewater surveillance from the north is concerning, like PA and North Belford. But really, if we can keep it as much as possible from not coming all over the province, not all the rural areas, all the northern areas, all at once, I think that's also going to relieve pressure on the hospitalizations, which for the most part would be acute care, shorter length of stay. But again, this has to be managed and watched very closely, and other mitigating measures may still be required.
I just add to that, Mickey. There's really a battle that's being waged in some cases on two fronts, and we saw a number of provinces and states across the United States as well that had significant Delta populations or case numbers as they went into their Omicron wave. Here in Saskatchewan, our Delta wave hit us, quite substantially this fall. Saskatchewan people, not governments, people were able to wrestle our Delta numbers down to quite a low number as we went into our Omicron wave. And so we're quite pure in the cases that we have today in Saskatchewan, to the point that we're not we're not doing testing as to whether they're Delta or Omicron. They're virtually all Omicron here in Saskatchewan. And so what we are seeing with some of the hospitalizations in other jurisdictions, of which Omicron will take over and likely has by today, but over the course of the last number of weeks, we saw provinces like Quebec go in with 1,000, 1,400 Delta cases as Omicron started. Ontario, 1,000 Delta cases as the Omicron wave began. And so many of the hospitalizations that we'll be seeing yet today may very well be from some of the Delta infections they had underlying as the Omicron wave started to take over. We didn't have that base increasing level of Delta here in Saskatchewan. We had it a couple of months earlier here in the province, of which Saskatchewan people were able to wrestle to a much lower number. That being said, as we move forward, and we'll have more information on this tomorrow for the POC committee, or the Provincial Emergency Operations Center, as to how we are planning, some surge capacity, in particular in our acute care, as we may see an increase in our acute care numbers over the course of the next number of days and weeks. So they are going to provide some transparency and some information to everyone on what that surge capacity looks like, as well as I would say that we've inquired yesterday, and full disclosure, watched what happened in Ontario. We've inquired as to how many international healthcare providers that we have with our our self-governing bodies out here that have applied to come into Saskatchewan, and is there an opportunity for us in this province to allow those folks that have applied to work as a nurse, as an LPN, as a CCA, to bring those into our healthcare facilities, because we will need them in the weeks ahead as their applications are being processed by their respective governing bodies. So that inquiry is working its way through the healthcare bodies as of today, and which speaks to one of the challenges that we'll have with Omicron. In addition to, potentially increasing hospitalizations, much less than Delta has provided, we are going to have a number of people in our healthcare sector, in our education sector, in other essential services and other businesses that are going to be required to self-isolate for a period of time. Just the sheer numbers of Omicron infections that we're going to have are going to, stress and challenge the services that we're providing in our community, and that includes our education sector and includes our healthcare sector. And so that is why we're providing this information tomorrow on the surge capacity. That's why we're saying that we're inquiring, is there other folks that are trained that could come into our system, or into our healthcare centers as their applications are being processed to help support some of the folks that work in our healthcare sector, as well as support some of the people that are utilizing it, whether it be for COVID or for whatever other reason. And so there'll be more information on that tomorrow.
Follow up, Mickey?
Yeah, I just kind of want to expand on the surge plans. I know it's, happening tomorrow, but the public doesn't get to tune into that, and then, they just get to read what media publishes. Can you tell us a little bit about why we are surging? Is it because we are expecting more hospitalizations? Is it because we don't have, is it because we have that shortage of workers, or is it both? And what are we surging to?
Yeah. So I think it's a combination of both. So first of all, and again, we're actually, in this is one way where we are 2 to 4 weeks behind other provinces, and maybe 4 weeks behind the UK. So we're actually learning a lot from how it transpired there. So obviously, like the Premier said, they saw the Delta wave morph into an Omicron wave, and even here it took 4 to 6 weeks for our ICU admissions and hospitalization from the Delta wave to come down. Especially for ICU, there was a long length of stay, so they did come down significantly over end December, early January. So in terms of the pressures in all sectors, health, education, all sectors are certainly from staffing. And because, at any given time, you may have 2%, 5% of your workforce isolated for a shorter period of time. Over 4 to 6 weeks, it can be a substantial proportion of the workforce who may be off for a particular, for 5 to 7 days. And what you want to do is that if you have, for example, in a workplace of 100 people, if you have 10 people who have a specific role, you never want those 10 people together in one room ever, because you don't want all of those 10 people coming down with Omicron at the same time. So, keep them separate in terms of shifts and other things and all the other tools. So I think that's going to be important for healthcare, but also other sectors. So that is going to be a significant pressure, but short-lived, because for most people, by 5 days, you're able to go back to work. In some specific situations where you work on your own, you're doing a critical job, if you're asymptomatic but positive, you can also get an exemption and actually do your critical job, whether it's maintaining an essential utility, because you're not posing a risk to anyone else, as long as there's no one else in that area where you're working. But then, of course, in terms of hospitalization, again, we are looking at the actuals in other provinces in the UK. And even though the hospitalization may be, again, some data saying as low as 0.3%, but because the case numbers are large, and again, what is the nature of people being hospitalized? So like I said, it is still, and even on our dashboard, more than 50% of hospitalization is still in unvaccinated, in Saskatchewan and other provinces as well. So that again is a message that if you're unvaccinated, please get vaccinated. That will automatically reduce up to 50% of hospitalizations. If you're vaccinated but 3 months out from your second dose, get boosted. That and other measures we talked about masking and all that, can reduce our hospitalizations by up to 50%. won't come down to zero, but can reduce it to 50%. So if you can just do that, we will follow a gentler curve on the surge plans. So that is the most optimistic scenario that the SHA will be speaking to. But of course, if we get a rapid escalation in many communities in Saskatchewan, it can lead to a more higher slope, and that can be very challenging, both in terms of staffing, but also managing people, mostly in acute care, but some also in ICU. And again, I think that will be presented. We are talking about how you can prevent that from happening in the first place as much as possible. It will happen, but how can you keep the slope more gradual and the peak lower? And then on the response side, the SHA will speak to what their plan is.
I just you say the challenges that we see in other countries with Omicron are somewhat different. Not totally, but somewhat different than what we experienced here in Delta a few months ago. In Delta, we had higher than what we wanted in hospitalizations, and much higher in the case of ICUs, to the point that we had to rely on Ontario to take a number of our ICU patients. As we look ahead to Omicron and look at some of what has happened in other areas of the world, the ICU pressure seems to be substantially less with Omicron versus Delta. However, there seems to be some general admission or acute care pressure that may be coming. And so what we're presenting tomorrow, the Provincial Emergency Operations Centre will present is what our plan will be and what will trigger different phases of that plan. That plan isn't going into place tomorrow, but what would ultimately trigger various phases of that plan. Two things I think would be be looked at as what could potentially trigger various phases of that plan, and ultimately moving some folks around in the healthcare system, not to the degree that we had to before, and in a much more phased approach. One would be, in the same way that our education sector, our schools, other essential businesses are planning for interruptions due to staff that are having to self-isolate. We should be under no illusions that our Saskatchewan Health Authority, our healthcare system, isn't going to experience those same pressures. There'll be days when we have 5 and 10 and maybe 15% of our employees that are providing those services may not be able to be at work for 5 days as they self-isolate, testing positive with COVID. Second is if our general hospitalizations do start to increase, and we've seen them go up over the course of the last 3 weeks here or so, not near to the level that we're seeing in other areas of Canada, and that's thanks to what Saskatchewan people are doing. But those are the two metrics that I think you'll see the PIOC committee really look in at tomorrow is what can we do to ensure that we can not only care for COVID patients, but keep as much of the healthcare system operating as possible if we experience some significant staffing shortages, and if we experience some increased pressure due to COVID hospitalizations.
We'll take another question in the room. Lynn?
Yeah, listening through this, honestly, I feel very confused because we're hearing that we are already planning for surge capacity in hospitals. We're looking at other provinces that have already seen those hospitalizations increase. We're expecting the same to happen here. And we know that we're 2 to 4 weeks behind those other places. And hearing things like up to 15% of SHA staff potentially self-isolating from day to day is probably concerning for healthcare workers who already feel short-staffed a lot of the time. So knowing all of those things now, why are we not putting more preventative measures in place so that that doesn't have to happen?
I don't know that where you're seeing other jurisdictions, other provinces where there's additional measures in place that you're seeing that not happen. And there is some differences between what is happening here in Saskatchewan and what is happening in other areas. And I spoke to the Delta concentration of case numbers that a number of other provinces had as they layered in their Omicron cases on top. And they're really waging a battle on two fronts. They have the much more severe Delta strain that they had and if you go back and look at the numbers, Quebec, Ontario had 1,000 or 1,400 cases a day. We know what high numbers of Delta can do in the case of putting pressure on our hospitals here in Saskatchewan. We experienced it and lived it firsthand last fall. And you add into that, in those jurisdictions, significant Omicron populations as well. What we're doing tomorrow is putting forward a plan not into action tomorrow, but a plan on how the healthcare system will react, and many other provinces have done this already, put in place their plans, but how the healthcare system will react to continue to provide service, not just for COVID, but to provide service in light of potential staffing challenges that we're all going to experience across our communities, to provide the general healthcare services that we are. There's going to be stress yet again on our healthcare system. There's stress already today in our education. There's going to be stress and interruptions in our communities, and it isn't going to be interruption free. And so what we're going to do tomorrow is put forward that plan. What I added to in addition to that is we're looking at, is there ways for us to further support that plan that will be coming forward tomorrow in the way of, bringing those international applications that we have into healthcare into our facilities so that they can actually provide services while they're awaiting their credentials to be approved by their respective regulatory body. And so we're bringing this all together yet again as COVID presents us with another challenge. But the tools that are being utilized here in Saskatchewan, if you look at what's happening with Saskatchewan hospitalizations versus virtually any other province, the tools that we have made available to Saskatchewan people, at least for the time being, appear to be working and appear to be quite effective as any of the measures that have been implemented in other areas. But do you have anything to add to that, Dr. Shaw?
Thanks, Premier. So maybe I'll just share a few observations, and many of those are just from observation and getting feedback from friends and family and colleagues, and I'm sure all of us do that. That, over Christmas and New Year's, there were no limits on gatherings, and we had the few reports of, large events that are poorly planned. But for the most part, I think people were quite responsible over Christmas and New Year's, I think. So I think, again, people did adjust their behavior to what was happening at that time. Delta wave had really settled down. We were seeing early phases of Omicron picking up. Now that we are, over the next 2 to 4 weeks, going to see a significant rise, I think, again, what I'm hearing is that people are changing their behaviors even more. They are reducing their non-essential contacts. Even if you look around in this room, people have changed their masks. They're wearing their best mask, and in many cases, it's fitting really well around the face. So we've all changed our behaviors, haven't we? Like moving from maybe a 3-layer cloth mask in some cases to a medical mask, maybe to another type of mask that fits better. And so, and that has an impact. That just this change alone can reduce our transmission by up to 50%. So we should never underestimate the impact of our individual actions on our, collective transmission rate. And boosting, again, I'd like to emphasize that, without a requirement for boosting, 77% of 80 plus have been boosted. We were the first out in Canada with offering boosters to 80 plus, 72 plus 70 and older, 62 plus 60 and older, but still room for improvement. So those who haven't gotten boosted, 45% 50 and older. So these age groups, more at risk for hospitalization, really do book your appointment. There's lots of appointments available for boosters. But even 18 and older, the uptake is only about a third. Boosting will reduce your risk of even mild illness and transmission, not take it away completely, but reduce it, and reduce the risk of you exposing others. So I think these two things I'll again like to emphasize can make a significant difference, as well as, generally we've become even again more after a bit of a respite over December. We've again become more conscious at work about not crowding together in the lunchroom when we take our masks off to have a meal, maybe staggering lunch breaks for mission-critical staff, and those kind of things, again, are going to be very important.
Follow-up?
I don't want this to be my other question, but just to clarify, will that international worker information, is that part of the surge capacity information that will be coming?
No, it's an inquiry that I've made within our healthcare system as to what I think the numbers that we saw in Ontario is they have in excess of 1,000 international workers that have made application to become certified as an RN, an LPN, a CCA, whatever that might be, physician possibly in Ontario. So I've made inquiries as to what number of applications do we have that could be beneficial for for our healthcare centres as we look through the next number of weeks. And then secondly, understanding they're governed by self-governing regulatory bodies, is there an opportunity for us to bring those individuals, whether it's 100, 200, whatever that number might be, bring those individuals into our healthcare centres to assist our healthcare workers in providing the services that we have even earlier, prior to them being fully certified, but while their paperwork is working through the certification process.
And then if I can ask my other question then. I know that a lot of experts are concerned about the inaccuracy now of the case number data, and some of them are trying to track it on their own through processing rapid tests, like people self-reporting those. And through the news release today, we saw that that's because there's a lot of increased pressure on the PCR testing system. Like, what is the pressure on the PCR testing system right now? And for both of you, are you concerned about inaccuracy of data with those rapid tests not being reported anywhere?
Go ahead, Doctor.
So I think, first of all, and I said that in my opening remarks, we cannot rely on testing numbers alone. This is a very different phase of the pandemic. We will have to rely more on the lagging indicator of hospitalizations. And PCR will, no matter how much capacity you deploy, it will not be able to keep up. So again, up to last week, we were saying that if you're asymptomatic, do an antigen test. But even that, some people were doing antigen tests daily or 3 times a day. Just because we have a lot of capacity doesn't mean that we should overuse that. For most people, doing an antigen test on a Monday, for example, is good in terms of going to school or work. There's some concerns in your school, high transmission, you could do a second Wednesday or Thursday. So 2 tests may be a good idea. Within the household setting, if you have concerns, maybe just one person on a particular weekday doing an antigen test could work for that household to just get a sense of what the exposure level is. Obviously, antigen tests are not being reported officially. There may be an option for that, but there's a site that's actually run out of University of Saskatchewan that lets anyone in Canada report their test and gives with very little information such as your postal code, age. I think that could be an additional tool. Obviously, it's not going to be complete, but it just gives you a sense of what's happening. What we have learning from people who are not even concerned but have to require a test because they require it as an alternate for proof of vaccination, or because they have to test because of travel. What we're seeing that we are seeing an increase in proportion who are positive from less than 1% even during Delta wave. Less than 1% of tests for travel or other reasons were positive, but now they're creeping up to 2 to 3%. And we saw that in London, UK, up to 10% of all tests for such situations or random swabs in the population were positive, so up to 10% community prevalence rate, which is very high. But that is creeping up. So that, again, is a different reason why people are getting tested. It's not representative of the entire population, but that's giving us a sense that, at any given time, if you take a random group of 100 people, up to 2 to 3 may be positive at any given time. And that is, we expect that to keep going up to 3, 4, 5%. And hence, again, your best mask at all times, an antigen test maybe once a week, or if you have any concerns. We have to remember, if you're symptomatic, right now we say that if you develop a fever, your symptoms are worsening, do get a PCR test, especially if you're older, because then the diagnosis may help in ascertaining if you need, for example, additional therapies. But if you're younger, you have mild symptoms, stay at home for a couple of days. You may do an antigen test. If it's negative, that doesn't still rule out COVID. It can be negative in 30% of cases. Continue to stay home until you're symptom-free. If your symptoms continue to worsen, you're otherwise young, healthy, you can repeat your antigen test. But if it's still negative, stay home till 48 hours after symptom-free, which may be 3, 4, 5 days. And by 5 days, in any case, if you're COVID positive, you are able to come out of isolation on day 6, but continue to wear your best mask. So I think all these things mean that we really have to, for the most part, self-manage, even if we test positive. And what that means is, staying home for 5 days, taking care of our hydration. If your symptoms are worsening, obviously we can call our primary care provider for advice, or call Healthline. And of course, if symptoms are becoming very worrisome, seek more emergent care should also be done. But I think it is going to be more self-management, and no country in the world can, keep up with the demands of PCR testing specifically.
I'd say we're seeing in virtually every other province that they are unable to keep up with public PCR testing for the demand that they have. We're fortunate in this province. We have really three main testing access points that are available to Saskatchewan residents. First is our and I want to comment on the scope between them, the ability each has for the number of tests. But our public PCR tests are available, and I leave it to Dr. Shahab and others to provide the guidance on when you should and when it may not be necessary to go for a public PCR test. But we can deliver up to about 4,000 of those a day, day in, day out, for a period of time. We have our private testing capacity that has been made available for those that are maybe traveling or those that may not be vaccinated, require an official proof of vaccination. We didn't want travelers and such being in line with those that may need a public PCR test. And so I don't know to what degree our private testing capacity has been built to in this province, but I would say it's likely substantial, or at least rivals the public PCR testing that we have. And there's both PCR and rapid tests available through private providers. And last and most significantly, I would say, is the at-home tests that we've been able to procure through the PIOC committee here in Saskatchewan. We're running about 4 million tests being available to Saskatchewan people each month. That's about 125,000 tests that are available each day here in the province versus 4,000 PCR tests that are available that you have to go out for and come together either with other people or whatever that might be, as opposed to a rapid antigen test that if you have it on your shelf at home, it's convenient, it's quick, and it gives you some pretty good guidance on in a much more reasonable time frame as to whether you may have actually contracted COVID. And what we're seeing, and what I saw over my time back in my constituency and back in where I grew up, is Saskatchewan people have accepted the benefit of rapid tests and done so very well. I think most have them in their home. If you don't, I'd encourage you to go out and get them, and then utilize them. Don't utilize them when it's unnecessary, but utilize them when you do feel it is necessary. It ultimately, in a much quicker and more convenient way, is able to give you an indication as to whether or not you have COVID, and give you then the guidance to self-isolate for 5 days. And really, this is one of the more significant tools that we have, in addition to vaccination, in addition to masking, to slow the spread here in Saskatchewan, as Dr. Shahab said, maybe from a 4-week cycle to maybe a 6 or 8 week cycle. And rapid tests are a very effective tool for that because of their convenience, because of how quick they can provide you with a result. And here in Saskatchewan, we have over 100,000 available each and every day for families to use. I would encourage them not to abuse their access to these rapid tests, but to most certainly use them when they feel it's necessary.
We'll take our next question on the line. Operator?
We have Allison Bamford with CTV.
Hi there. Dr. Shahab is recommending people don't gather at all except for work and school for the next 2 to 4 weeks, and has said other mitigating measures may be needed. But Premier, you're saying gathering limits and restrictions in other provinces aren't working. So do you agree with Dr. Shahab that people should not be gathering? And if you do, why not put in a gathering limit? Because
we have the advice in place that has been provided by Dr. Shahab, and what I see across this province is that you people are adhering to that advice. Are they gathering? Yes. Are they taking precautions when they do gather? For the most part, I believe they are, and I'm observing ultimately that they are. Are they gathering as much? No. The same people that may come together from time to time are choosing to not come together at other times, and they're doing, and this is what we want Saskatchewan people to do, is to do your own personal risk assessment. Utilize the tools that are available. Go out and get vaccinated. Go out and get your booster shot. Use a rapid test if you feel it's necessary for whatever you may be doing that day or that particular week. And what we are seeing is Saskatchewan people, most certainly are availing themselves to those tools. They're doing their own personal risk assessment each and every day, and they aren't gathering near as much as we maybe would have 2 or 3 years ago. For sure, they're making making those decisions as they feel necessary. For us to enhance public health measures, as I said, it doesn't appear to be reducing the cases in other areas of Canada and other areas of North America and even other areas of the world. And there's consequences. There are other consequences to keeping our students home from school. There are other consequences to not allowing, a grandmother, for instance, to see maybe her children and her grandchildren by putting in gathering restrictions. There are consequences to people not being able to go to their place of employment and actually losing their job for a time period. And so what we are doing in this province is making every effort to make the tools available to allow people in Saskatchewan, and they are learning how to live with COVID, and they're utilizing those tools to reduce the risk to the greatest degree possible, but still trying to forego some of the consequences of what limitations, the shutdowns, and public health orders might potentially have on on the people that we ultimately as a government represent. Dr. Shahab, do you have more to add to that?
Yeah, maybe I'll just say that there's a few events that maybe like a trade show that are more like a retail environment. So we already know that retail has already always been safe. Even with Omicron, it's continuing to be safe, and people have just upgraded how they how consistently they wear the best mask even when you're going shopping. And so those kind of environments generally continue to be safer. What many people I've heard have been doing, that even at events that are still allowed, there is some attempt to maybe limit the capacity. Many events have obviously been cancelled because of the high transmission risk. But even in some settings where there is a larger gathering, there is an attempt to space people out. Many people are opting to keep their mask on at all times, not have a refreshment while they're in that setting, even though it's a bigger space with better ventilation. And I would say again, bulk of the transmission outside the household happens really in those, family and friends getting together at home where masks are off and you're maybe sharing a meal. And again, what I've said is that if you do need to gather, it should be a small, consistent group. Sometimes there's caregiving arrangements, other arrangements that are critical. You're checking in on a friend or family member, and that's fine. But trying to keep that mask on at all times, improving the ventilation, putting up ventilator fans in the house, maybe, especially as the weather's improving now, even opening windows an inch or two a few times while people are visiting, all of that makes a difference. And then being aware of risk factors that individuals have. If someone is just recovering from cancer treatment, maybe being especially cautious around individuals at high risk is also going to be critical.
Follow-up, Allison?
Yeah, so the suggestion right now is if you're symptomatic, kind of bypass the PCR, get an antigen test, but the Workers' Compensation Board is only accepting claims if there is a positive PCR test. So what is your message or advice to employees who are symptomatic? Should they be getting that PCR test, or should they still be sticking to the rapid antigen test?
Allison, that's a good question. We've heard some concerns with respect to this, and we've asked public health to reach out and to work with the WCB on what has happened in the past. For example, we've had H1N1, other similar type environments in years gone by, and to come up with some answers on behalf of Saskatchewan people. Dr. Shahab, you might have a little more to add to that.
Yeah, I think we'll maybe provide further details in, I think, a technical briefing tomorrow. But I just like to say that, I do want to recognize that people who work in healthcare, education, retail, essential services, trucking, they've been out throughout the pandemic. We're entering our a third year, actually, if you can believe that. And they have been out throughout the pandemic. I think in most cases, employers have supported people at work, supported them being off while they're sick, and I think those principles should apply. But again, I did check the website on WCB about what the requirements are for, assessment, and I would rather that they speak to that tomorrow at the technical briefing. Thanks.
We'll take another question on the line. Operator?
We have Adam Hunter with CBC.
Hi, thanks for taking my question. I have a question also about gathering limits. Today, Dr. Shahab said that we need to spread out infections. For the Premier, wouldn't even limiting large gatherings, even private parties where there aren't precautions being taken, prevent some cases that would keep cases out of schools, healthcare, and workplaces. Why not put that in now?
What we are seeing is, in many cases, even in jurisdictions where those types of restrictions and many more really aren't limiting the spread of Omicron. We're seeing Omicron spread regardless of what type of limits, public health measures are in place in Saskatchewan. The approach that we've taken is to provide a suite of tools to Saskatchewan people for them to utilize, and they are availing themselves to those tools. And it, to date, seems to be working with respect to our hospitalization numbers here in the province. Canada up since December 21st. Canada is up with their hospitalization by some 377%. Saskatchewan's number is 23. When it comes to the ICUs, Canada is up about 107%. Saskatchewan's ICU numbers actually are down 65%. And that is due to what Saskatchewan people have been doing in going out and getting vaccinated. Making their own personal risk assessment in whether or not they're attending the events that you had mentioned, and I suggest that, and I've observed that many are not. I don't think attendance of any of our significantly large events is up by any stretch. In many cases, it's lower as people are making their own decisions, and that is allowing for, in many cases, in these larger events, for people to spread out, whether that be in an arena, whether that be at a trade show, wherever that ultimately may be. And so, Saskatchewan people are doing a remarkable job, and it's a job that the job that they're doing is having an impact on where we are with respect ultimately to our hospitalizations. And so, at this point, Dr. Shahab's guidance continues, and there's no need at this point to add additional public health measures, as we don't see them being effective in other areas, and we see what we are doing here in the province being quite effective. That being said, and you mentioned schools, and I've mentioned this a number of times prior, is, as we move ahead, whether you're in Saskatchewan or any other area of Canada or North America that is experiencing an Omicron outbreak, there's going to be interruptions. And we need to be patient with one another as we find our way through those interruptions. We need to support one another, whether that's family members, whether that's work colleagues, whether that's students in our schools or educators in our schools or those that are working in our healthcare system. We need to support them through these interruptions that we know are coming. But we are making a decision to not interrupt everybody for an extended period of time. We're going to work our way through this by supporting one another, by making decisions with respect to our own personal risk assessment, using and availing ourselves to the tools that are available, and we're going to find our way through this in this province. Dr. Shahab, do you have anything to add on that?
Yeah, just one thing I'll just maybe again emphasize is that when we look at historically we've had 50% of our transmission has been within the household setting, and then in settings where close friends and family are in the home without masks. And what I do want to also emphasize is that with Omicron, data is showing that with Delta, the household transmission rate was anywhere from 10 to 25%. So, and obviously higher if you had crowding in the household. With Omicron, it's 25% or higher. And we already heard stories that, household fully vaccinated, parents are boosted, children fully vaccinated, Omicron comes in and everyone gets it within 5 days. It is really hard to prevent transmission in the household. But again, just like for the workplace, many more households will get Omicron now than we'll probably see more households with Omicron than we've seen households with a COVID case in all the 4 waves before. And we all need to have a plan that if, one person gets Omicron, what's the plan? How will that person isolate? Can they have their own washroom, preferably, or not? Otherwise, how will we clean the washroom between use? Who will prepare meals? Who will come down when? Mask use, if you have a child and you need to provide care to that child, do you have your best mask to wear while you provide care? Because I think that is going to be really important at the household setting, self-management as a household unit. And then, of course, For individuals living alone or needing assistance, how can friends and family assist? I think that again is going to be critical. We've heard that there's been a lot of calls to 811 that are also important. If you need medical advice, I think you should find out if your primary care provider can provide advice on the telephone as well, because obviously if you don't need to, you shouldn't be sitting in a waiting room. But I think all those things we should already make our plan. If we have underlying health conditions like asthma, are we on the right treatment right now? All those things are going to be important as well to both minimize household transmission, but in many cases it's going to be very difficult, and we should be prepared for that. And then to self-manage as individuals and households, and also as friends and family, how to safely support households who may be isolating for 5 days or 10 days, up to 10 days, how to support them with food and other items they may need.
Follow-up, Adam?
Yes, Saskatchewan seems to be taking a different route than other provinces when it comes to limiting gatherings and get-togethers for people, both public and private. And I'm wondering the strategy behind that from the government's point of view. Do you think that this wave is going to be short and you're going to be able to avoid it, or are we behind other provinces in this wave and we could get hit later? What's our strategy here as far as doing something that's different than everywhere else in Canada?
Yeah, what Saskatchewan is facing, and maybe even to some degree Alberta, is a little bit different than other provinces in Canada. As I said earlier, we saw not every other province, but a number of provinces had significant Delta numbers going in to their Omicron wave that were there and present. Eventually, they'll be overtaken, is what the medical professionals say, is that the Omicron will eventually overtake the Delta numbers. But they had significant numbers, going into early parts of December, mid parts of December. And we know what, numbers of 1,000, 1,500 Delta cases will do in the way of hospitalizations in Saskatchewan, as we dealt with that a couple of months earlier. In Saskatchewan, what we are facing is predominantly Omicron, which is the Omicron variant, which is going to present a couple of challenges for us in the weeks ahead, which is why we're asking Saskatchewan people to double down on their efforts, to be careful, to utilize and avail themselves to the tools that they have: vaccinations, masks, booster shots, and ultimately rapid tests, and utilize all of those, is because we want to stretch that time out, as Dr. Shahab said, from maybe 4 weeks to 6 or ultimately 8 weeks, to alleviate some of the hospitalizations that may come into our facilities in Saskatchewan. A few of them, admittedly, have already arrived. But to date, for example, I'm not aware, or I haven't been informed, that any of our ICUs in our hospitals are from Omicron. They remain from ultimately the Delta variant. So as we move ahead, we feel that what Saskatchewan is facing, we're well prepared for, and we're making preparations where there may be pressures. For instance, Dr. Shahab has encouraged all of those to have a contingency plan in place for for staff in their business, in particular if they're offering an essential service. We're going to come forward with our surge plan in our healthcare sector. I'm sure our school boards have given much thought to what their contingency plans look like as we do experience interruptions due to staffing shortages, and we're going to experience those across the provincial government and in our healthcare sector, and so that some of that information will be will be provided tomorrow. I had also indicated we're looking at, is there, some international folks that we might be able to bring in to support our healthcare staff. In addition to that, what we'll see tomorrow is the surge capacity that we'll be able to address should we see any increased hospitalizations from Omicron, the Omicron variant that is providing our higher case numbers here in Saskatchewan. Very little Delta is present in Saskatchewan, and so we'll have that preparation plan available here tomorrow.
We'll take another question on the line. Operator?
We have Mary Mandrick with the Leader Post.
Hello. I'd just like a bit of clarification on a few issues that have come up, because I think the public isn't getting the details that they were looking at or looking for. In Dr. Shahab first, I guess in relation to Mickey's question about how much we can expect in terms of hospitalization, can we expect under Omicron it to be similar to what we saw in Delta, given what you said about 5 to 10 times as many cases? You said previously the 200 cases would be problems. Can we expect it at that level? Can we expect it at the 356 hospitalization max, I think, on October 6th? How many hospitalizations are you predicting? And secondly, do you happen to agree with the notion that measures elsewhere aren't preventing hospitalizations, as are measures in Ontario elsewhere that your colleagues across the country? Is it your professional opinion, though, that those measures aren't representing on hospitalizations, and how many hospitalizations can we expect?
I just want to clarify my comments from earlier, Murray, were with respect to what we're seeing in other areas as measures don't seem to be having any impact on the case numbers in those various jurisdictions. I didn't comment on the hospitalizations, as there's differences between the various strains that are present in various regions of Canada. But Dr. Shahab, on that.
Yeah, thanks. And I'll first maybe address the first part of the question, that I think the Saskatchewan Health Authority will present their projections, but I think the projections can follow three trajectories. One is the more optimistic, that we will see lower acute care hospitalizations and significantly lower ICU hospitalizations over the next 8 to 12 weeks, that will be managed in a way that will not cause a lot of disruption to other services. Having said that, there are less optimistic projections that could see higher acute care hospitalizations than we've had even in Delta. But then there are some estimates of will there be a shorter length of stay? Will there be a lesser requirement for high flow oxygen, for example? Similarly, there are projections that show that there may be an increase in ICU admissions, but then would there, how much of that would be similar to Delta, which created a lot of pressure on ICU, long length of stay, high reliance on ventilator use, and there may well be a subset of that which will be the same, especially in people who are unvaccinated. But then, how will that be managed at a provincial level with load leveling throughout the province? But again, that will be impacted. How quickly this wave comes? Does it come at the same time throughout the province? Can we kind of slow it down within, for example, Regina, Saskatoon, and slow it down and not coming all the time? And the reality, of course, that even communities that have tried their best, now the remote communities, where in the past they would see 10% attack rate in a community of 1,000, 100 people, they will likely see, despite best efforts, anywhere from 300 to 500 people getting mild illness. And how do you try to prevent a large transmission event? And again, I think the challenge, of course, is that the context is very different. So now coming to the second part of the question, obviously complete lockdown puts brakes on transmission, but it comes at a cost, a mental, social, economic cost. And different jurisdictions have tried different ways, and there's a stringency index that has 30 sub-themes that you can apply and mix and match. So I think different jurisdictions have applied different things. Many European countries applied less measures while they were peaking, but as hospitalizations are a lagging indicator, they've had to put some significant measures in, even though they had passed their peak, just to further prevent pressure on the hospitalization rate. But again, I would say, the basics still remain fundamental: mask use, getting your boosters in. Many European countries have high vaccination rates, low booster rates. Many European countries have low vaccination rates, and the pandemic is playing out differently in those settings. The UK, of course, I certainly have been following very closely. They have put in their Plan B, which is similar to what Saskatchewan has had throughout, September onwards. But in addition to that, they have had to put in more stronger measures in local areas where transmission rates are very high. And we have to remember that London at one point 1 out of every 10 people was Omicron positive, but they have since peaked, and other parts of the UK now, rural areas are seeing their peaks coming, but some of the rural areas are seeing a slower rise, so higher density, large urban areas where a lot of reliance on transit, for example. The dynamics are different than more rural areas, even in countries like the UK. And of course, in Ontario, Quebec, obviously, the way the epidemic is traveling in large urban settings, smaller settings, I think all of that obviously are we are watching closely. But again, our transmission dynamics were such that we were able to start school. But again, over the next 2 to 4 weeks, there may be increasing pressures on staffing and cases in schools, which again, they will likely be lower than the transmission rates in the community, but and every effort will be made to keep in-class learning. But obviously, I think we have to look at what measures work in what setting. But again, I would say that ultimately each jurisdiction, both at a provincial level and local level, has to make decisions. For example, if you have gyms that are in a wide open space, and many gyms in Saskatchewan are, it's not to say that gyms with the current measures in place will guarantee there's no transmission. There may well be transmission, and many people may choose to opt to exercise at home or outdoors instead of going to a gym. But gyms generally that are well ventilated, have a lot of space, where there's mask use at all times, where there's physical spacing between machines and treadmills, the transmission rate may be lower, and proof of vaccination or negative test is required, for example. But there may be some gyms, for example, not so much in Saskatchewan, but maybe in other provinces where they're more kind of a shop front with lots of individuals crowded together with poorer ventilation, less physical distancing, and so again, all those factors play into what kind of measures work in what setting. But there is a role for public health measures in various sectors, including restaurants. Some restaurants went to 50% capacity in other provinces. Some have just gone to take out. And again, I think what the government is saying is that do your own risk assessment, support your local businesses, but maybe order more takeout, especially if you're high risk. Because right now in a restaurant, even with POV, and I said that I think 2-3 weeks ago, the risk was low with Delta in a restaurant POV, a negative test, because you do have to remove your mask, but Delta was less transmissible. Now the risk is moderate, and so if you are at higher risk and don't feel comfortable, do support your local restaurant or business, order takeout, because in a restaurant obviously you do have to remove your mask to eat. So I think all those factors do play in, but I would say that I think each jurisdiction is trying to balance between keeping things going, especially essential sectors like schools, supporting businesses, letting people do things that they're able to safely do, but also using risk assessment. And again, I would say, hopefully we don't reach a place where we are following the worst projections that the SHO present, but if you start tracking on that, I think we will have to rethink everything even again. Thank you. Sorry for the long answer.
Follow up, Murray?
I don't know if there is one after that. Mr. Premier, you're asking people to double down on their efforts. You're not. In an earlier question, you were asked why no new additional measures at all, and you talked about not wanting to lock down schools, and I get that. But why no measures at all? I think what Dr. Shahab is saying, that there is a likelihood, a high likelihood, I'm thinking he said, of added cases, added hospitalizations. Why not at least social distancing? Why not some measures that we had in place that would be less harmful to the economy, but would perhaps allow the government to show that it is actually leading in terms of its efforts to reduce Omicron spread, and not just asking the public to individually double down? Why nothing at all today beyond what we've had?
Well, I actually disagree with the premise that doubling down doesn't mean we have to put in additional public health restrictions on the citizens of Saskatchewan. And I think, in a large majority of people that I talk to actually agree with that statement. And a large majority of the people that I observe and see, virtually all of them, already are doubling down in many cases, utilizing the tools that are available to them. I think we have over 40,000 appointments booked for vaccines and booster doses over the course of the next few days. Our vaccination campaign remains fairly robust here in Saskatchewan, even after 22 months of walking our way through 1 dose, 2 dose, and ultimately 3 doses. In fact, that booster campaign is leading the nation, and Saskatchewan people can be proud of that if you went out and gotten your booster. Doubling down means those of you that have not, we encourage you to make an appointment and do so sooner rather than later. Doubling down means if you do not have a package of rapid tests in your home, go get one. When you need them, we would prefer if you did your test, didn't leave your home in the case that it's positive, rather than go out and ultimately find one at that point, come in contact with some people, and then go do it and understand ultimately that you are positive. And to double down on ensuring we're adhering to the current public health restrictions that we have. And I think I also said earlier, as we find our way through the next number of weeks, we are going to have interruptions in our schools, in our communities, in the services that we're trying to access due to people that are self-isolating. And we should remember to be patient when we're approached with those interruptions in whatever your role may be as an employer, an employee, a customer, someone that is availing themselves to these services that may be going through an interruption. And we should support one another through this. Dr. Shahab had said we should, continue to make every effort to support local businesses in our community and in our province. And I think, as we go through the next number of weeks, being patient, supporting one another in interruptions that we might have, in ensuring that we're keeping those and those around us safe, that we're also supporting one another in our careers and in our local business environments. And so, doubling down doesn't necessarily mean that we need to put in a number of additional health measures. In fact, and just so my quote is clear, we're not seeing those additional health measures have an impact on case numbers in other jurisdictions to this point. What we are seeing is what Saskatchewan people are doing in availing themselves to the tools that they have, doing their personal risk assessment in what they choose to do each and every day as individuals and as families, as households, is having an impact on what we feel is starting to stretch out some of the case numbers here in Saskatchewan, but is having an impact on ultimately what we're seeing in our hospitals to date from Omicron. As I said, our ICU cases today, to my knowledge, I haven't been informed that any of those are from Omicron as of yet. Of our general 121 folks that are in hospital, 64 are in there due to COVID. 47 are in our hospitals for something other than COVID, although they do have COVID. And 10 we have not yet identified. So again, thank you to the people of the province for what they're doing and availing themselves to the tools. It's effective, and we need to keep doing it, and we need to double down on the efforts that we are making in the next number of weeks.
We'll take our final question. Operator?
We have Zach Vicera, Star Phoenix.
Hey, thank you for taking my question. I want to kind of, double down a little bit on Murray's earlier question to Dr. Shahab. So Doctor, this is for you. We've heard from the Premier several times he doesn't believe that the public health measures in place elsewhere are reducing case counts. I heard you say that mitigating measures may be necessary in the future, and earlier it seemed like you were saying that measures might work, but they obviously have accompanying costs. So let's put this really simply. If we were to have a gathering limit, let's say of 10 people in a private home in Saskatchewan right now, do you think that would help? Would that reduce case counts?
Yeah, so my message has been very clear for several weeks now. So over Christmas and New Year's, we were saying meet carefully. You should meet, but keep your group small and consistent. Right now, I'm saying actually because we are doing more, because children are at school, many people are back at work after a bit of a break. I'm saying very clearly, minimize your non-school, non-work contacts. For those with a busy household, minimize other things that you and your children are doing as much as possible. If it's not essential, minimize getting together with friends and family. Of course, there are situations where you are providing support to a family member, where if you're living alone, you need that social contact with 2 or 3 close, consistent friends. That is essential for our social and mental health needs. But absolutely, as much as possible over the next 2 to 4 weeks, I'm still saying, try not to have that gathering, push that back maybe towards March, April, because I think that can only help right now. Because even with staying home and we're sick, even with the antigen testing, we cannot guarantee transmission. Omicron is so infectious, and I would say maybe right now 1 or 2 out of every 100 people have Omicron and are transmitting without knowing it. And I think that number is going to keep going up over the next 2 to 4 weeks. So it may be 1 out of every 50 people next week and 1 out of every 25 people in 2 weeks. And so again, it's no one's fault, but it is highly transmissible. Even if you test positive on an antigen test, the test may be negative for the first 2 days when you're transmitting, but the test just is not picking up. So I think we do need to be careful, and as much as possible, I will continue to say that, try to avoid any non-essential contact, especially in the highest risk settings, home setting where you remove your mask, where ventilation isn't optimum. I think that is going to be critical.
Follow-up, Zach?
I'd like just a clarification before my follow-up, because I think my question was pretty clear. Would a 10-person gathering limit be helpful at this point if government were to say, hey, you shouldn't gather more than 10 people? Would that be helpful, Dr. Shahab?
Well, I would say, it could help. But again, I think the position has been that, are we going back to a situation where it has to be enforced, or is it more voluntary? Is it part of a public health order? But I'm actually saying a bit more than that. I'm saying where you don't need to even have 10 people in your house, don't do that for the next 2 to 4 weeks. But obviously, continue to support, people who rely on you for care, for social and mental health needs. You can do that virtually. You can do that in person. Continue to do that at the same time. But certainly, I think being very cautious against any gatherings in the house or any gatherings in any public place where it's not essential, I think can only help. But again, we know that there are life events that happen that, people do need to gather, and I think that's important as well. I think for 2 years, that's been a challenge. People have missed out on important life events that can't be pushed back, funerals, life events, so one has to be aware of that as well.
Follow-up, Zach?
And as my follow-up question, I'm hearing from you, Dr. Shahab, that a gathering limit might help, that people should really keep their gatherings to an absolute minimum to prevent Omicron from spreading to places where it can do a lot of damage. And you've mentioned already, we're just at the beginning of our surge. It's in younger communities right now. It may spread to older ones. And then I'm hearing from the Premier that what we're doing right now is working, and that gathering restrictions in other places don't seem to be working. And regardless of your intent, Premier, that would seem to imply that there's no point in gathering restrictions or in reducing gatherings right now. And I guess I just wonder, who should Saskatchewan people trust when they're hearing what, to me at least, are 2 different messages from both of you?
They should trust themselves, Zach, is who they should trust. And where you're coming at from your question is I would ask the question relative to what? So when you see a broad-based gathering limit come into place, whatever that is, 5, 10, 15, 20, whatever that might be in households, relative to what? And so the question you're asking is, will it help relative to how we used to gather with 15 or 20 or 25 people in our house prior to 22 months ago, prior to any of us understanding or knowing what COVID ultimately was? Sure. Will it help prior to what we see and observe Saskatchewan people doing today? When we see maybe a grandmother that wants to gather with, her children and their spouse and her grandchildren. Maybe that number comes up to 10, 11, 12. Maybe all of them that are available are actually vaccinated. If they're eligible for their booster, they may have their booster. And in many cases, those that might be in school or in contact with other people have access in Saskatchewan to a rapid test and are utilizing that rapid test before they ultimately gather. We are asking Saskatchewan people to use their judgment when they do feel it is necessary to come together. And I would say in the case of a grandmother or grandfather that are visiting their grandchildren in that type of a scenario that I put forward, if they're taking all of those precautions, most certainly that is likely a very, very different situation than what it was, 24 or 25 months ago prior to COVID. And so the question that you're asking is relative to what? I would put forward that Saskatchewan people most certainly should trust themselves. We have been saying time and time again, do your own personal risk assessment, avail yourselves to the tools that are available. That is ultimately what is going to keep yourself or your family members, those around you that you love, safe. And that is what we are observing is actually working with respect to our hospitalization load, of which the majority of Saskatchewan provinces are looking at now as we find our way into what is predominantly Omicron cases in province after province across this nation. And so to your question, who should they trust? Saskatchewan people should trust themselves.
If I can interject though, because that's really confusing. Like, does that not undermine the authority that health officials have in a sense? Like, shouldn't people be able, because they're not health experts, to trust the advice of the health experts talking to them?
No, they should trust themselves doing their own risk assessment using the tools that are available to them. We do have 2 public health orders that are in place. They adhere to those public health orders as they have been, but also, trust their own judgment when they're making their decisions on who they're going to see and use the tools that they have. There's not a lot of other places in the world that have access to rapid tests like we do here in Saskatchewan. The Saskatchewan people, and what I observed over my time over the holidays, is they are utilizing those very tools to ensure that they are stopping the spread of Omicron, and ultimately, as Dr. Shahab said, slowing it, I suppose is a better term, slowing that spread of Omicron so that we can experience whatever we're going to experience in this province over maybe 6 to 8 weeks as opposed to 4.
That concludes all the time we had for today. Thank you for joining us.